Welcome back to Client Side Chats. Remember, you can follow us on Facebook, LinkedIn, and our YouTube and Vimeo channels as well. So do subscribe, and you get notified as soon as we get some of these things up. But hey, today we have a very exciting, different kind of interview that's going to happen. We're still going to talk about COVID and some of those things that have occurred, but I would like to welcome Grace Marin in. Grace, how are you doing this afternoon? I know you're in New York, right?
Yes, I'm in New York City.
Yeah, absolutely. So Grace and I have had the unique opportunity to get to know each other as travelers, professional travelers. While I'm on the road, she's on the road, and we've been able to actually meet and develop a professional relationship and a friendship as well over the years as time has gone on and gotten to know each other. Very good stuff. And Grace, I know you've had a unique view and a unique perspective of this whole COVID situation going forward. Why don't you tell us what you do, a little bit about your company, and then kind of how that's affected you during this COVID time.
Okay, thank you, James, for that introduction. Yeah. So I've been a nurse for 32 years, and let's just say I never in a million years, if you told me 32 years ago I would be owning my own business and traveling all over the country, I would not have believed you. So my clinical background in that 32 years is in the Neonatal ICU, which is your little preemies and sick babies at birth. And then my life just kind of took off into a leadership role that I never anticipated. And that in turn turned into coaching. So I coach clients on communication, how that's measured with hospital patient experience metrics. And so it's a big deal actually in the hospital world that most people don't know, that hospitals are reimbursed by the government or not, depending on how patients perceive their care. And I don't mean clinical care, I mean personally communicating and with their nurse, with their doctor. So being in New York, it's been really fascinating, hard, lots of different emotions. I do feel a little PTSD after living through COVID. And sadly, my mom passed away of COVID 2.5 months ago. So for me, it's very personal. It's beyond just, what you see on the news. And so being a nurse, I couldn't help it. I had to just jump right back in. I called the hospital I used to work for, and I said, I'm in town. What can I do to support you? So I was training and onboarding 400 staff from all over the country who had to start working in the ICUs that were made, in units that weren't normally ICUs. So that was my contribution within COVID. And we're not done yet. So I don't feel like I can say we're done. But certainly we can breathe a little easier now. So my passion is really around seeing that aha light bulb moment for the person that I'm with in that moment. It could be a physician, it could be a housekeeper, it could be anybody, really. And that's where I find my joy.
And I know a lot of the skills and everything that you talk about that you do as part of your company for coaching and leadership and putting those metrics together also are relevant outside of the healthcare community. It's relevant for a number of different types of organizations that want to perform better. And I know these are some of the discussions we've had many a time when we've been together traveling. So that's been a good thing from there. Tell me a little bit more too. The COVID situation, I know, definitely limited your travel, at least out to the West Coast. I know that. Any other things that you see coming forward as we try to exit away from this pandemic quickly as possible?
Really good question. I've been thinking about this, that in the work that I've done, COVID or no COVID, we have a lot of leaders who don't know how to be leaders. And if nothing else, it's an opportunity to really look at oneself, to think about, do I make a difference as a leader? A leader doesn't mean you have a title either. So I can talk to a leader who's a lead housekeeper, but isn't a CEO, for example. And yet I've coached CEOs and chief nursing officers. It doesn't really matter. It really matters internally for yourself. So as I thought about how do we come out of this COVID nightmare that we've been in and emerge not with being beaten up, but with a renewed spirit of how to move forward from here. And the thing that resonated with me as I've been chewing on this is we have to learn how to take care of ourselves first. I don't know too many leaders who really know how to take care of themselves, meaning get enough sleep, simply. Eat the right foods, go for a walk, feed your spirit, whatever that looks like for you, whether it's going for a nature walk on the beach, reading a good book, something that nourishes your spirit. Because just like that oxygen mask metaphor in the airplane, you got to put the oxygen mask on yourself. And I say this to myself as I'm saying it to everyone else. We're no good to anybody unless we take care of ourselves first.
Very well put. So, well, I'll tell you what, this has been a really good conversation. It's definitely been unique in the types of conversations we've been having. And I think it's vitally important because a lot of our safety professional leaders actually tune into these things. And I think that advice sometimes gets lost with what we're really getting involved with, right? It really is. It really is. And it's easy to forget when you're in a profession like yours where you're really there to give as opposed to receive for yourself. So, yeah, that makes a lot of sense. All right. Well, hey, thank you very much, Grace, for being on. Greatly appreciated. I think everybody is going to really enjoy this. I would like to come back to you probably sooner than later, if that's okay, because as we transition through this pandemic, I would love to get your take on it, but also your take from the standpoint of leadership, from an organizational standpoint and a safety standpoint, as best as you could equate that, if that'd be all right.
That'd be perfect. Thank you, James.
All right. Take care, Grace. We'll see you back from New York hopefully soon. Yes. And thank you very much for joining us.
You're welcome. Thank you, James.